listen to somebody who is actually delivering a lot of results in very limited means, in very limited environment, in fact. In an area like Sikkim, how he's taking up healthcare services, how is delivering healthcare services to the state. Director General-cum-Secretary, Department of Healthcare and Family Welfare, Government of Sikkim, Dr. Kumar Bhandari. A round of applause for Dr. Kumar Bhandari, please.
Good afternoon, everybody. I'd like to thank the organizers for giving me this opportunity. And it's been a very good day. I've been enjoying the proceedings thoroughly. And I've met some of my very old friends and associates after 20, 25 years. Never knowing that we'll meet, it was a real good opportunity. By now, all of you have heard that I'm from Sikkim. I am the Director General and the Health Secretary. I've been in the helm of affairs for the last 5 years. Besides, I'm also a physician and a cardiologist. And I'm trying, whenever I have time, I do try to continue even pursuing my old profession also. And obviously, being a professional, being a doctor, it has helped me looking after health. And I think it is not a bad idea having a professional, a doctor, as a health secretary. Well, in Sikkim, health, you can see that our slogan is people first. When a chief minister now who's completed 22 years in office, when it formed the government in 1994, he has said that health has been a priority sector, and we wanted the people to be the healthiest in the country with the longest lifespan. Some general information, a lot of people don't know about Sikkim. People think, where it is, northeast, where, it's a sort of quite a confusion. For your information, Sikkim lies in the eastern Himalayas, and it's very interesting to know that we have, it's bordered by Nepal in the west, China in the north, Bhutan to the southeast, and West Bengal in the south. So four sides, we have 4 different, almost you can say, countries bordering us. It has an enormous attitudinal range in the geography from a lowly 300 kilometers to a dazzling 300 meters to a dazzling 8,586 meters. We also have the 3rd highest mountain in the world and the highest in India, that is the Mount Kanchenjunga. As per the 2011 census, the population in Sikkim is just over 6 lakhs, and today it might be around about 9-10 lakhs. So we are a very small state. Besides being a small state, we are almost, you can say, landlocked state. On one side, we have China border, we have restricted access. There is no direct access to Bhutan, although it borders us. There is a limited access to Nepal, and all access is through West Bengal, which lies in the south. And some of you know that Sikkim is a happening place. It is a very attractive tourist destination today. And the only railway line is about 125 kilometers from Gangtok, and so is the airport, which is situated in Bagdogra, North Bengal, and it is also 125 kilometers. See, as you can see, the geographical area is just 7,096 square meters. We have 4 districts. The total population, I already told you, 0.6 million. And a good thing is, if you see at the end, the literacy rate was more than 82%. One very interesting fact, in the morning we were discussing that in India, more than 60% of the health care is provided by the private sector. In contrast to that, if you see Sikkim, More than 90% of the health is provided by the government sector. We are a very small player. The private sector is very small player, and in fact, it has come into existence in the last few years only, because now the Manipal people, they have opened a hospital there, and they're also running a medical college. So they are the only, you can say, private partners of some sort. Otherwise, almost all healthcare, especially the primary and secondary healthcare, is provided by the government sector. We have one state referral hospital, large hospitals. We have 4 district hospitals. We have 2 community health centers, 24 primary health centers, and 147 sub-centers. Now what you can realize that 147 sub-centers for a small population is pretty good. So that is why we can cover almost every area, even the remotest of areas are covered by our primary health centers. Now, today I can tell you that we can boast of one of the best primary health care setups in the country. We are comparable to most of the big privileged states, like even Rajasthan, as far as a primary and secondary health care is concerned. If you see somehow, and this I'm saying it because if you look at our indicators, our birth rate is 17.1, the death rate is 5.1, infant mortality rate is 19. If you compare to the country's 40. In fact, when I took over 5-6 years ago, it was 40. And in the last 5-6 years, in my tenure, I've been able to bring it down to 19. So we're quite happy about that. Our TFR has come down. In fact, it has come down to 1.2. And we're really not too happy. This is one thing which we really don't want. And we are a little worried about this. And you see that our full immunization is reached almost 95%. And the institutional deliveries have gone on to over 98%. And so you can imagine that almost more than 98% of deliveries are taking in these government institutions. Then under 5 mortality, 32, and 3 or more, sorry, I go back, we are 3 or more ANC checkups has gone to 87%. The sex ratio, all sex ratio is fairly okay, 942, but we're a little worried about the 0 to 6 ratio, and which is 890 according to the last census. And we are a little worried. In fact, we are trying to do our own studies. And the trends show that something seems to be wrong with this ratio, that probably it's just not possible Sikkim to be doing badly as far as 0 to 6 ratio is concerned. Because in this state, women have the highest priority. Women are so empowered that today, if you look at my doctors, there are 3/4 female doctors and 1/4 as male doctors. That is the situation. Similar with any interview for undersecretary or even for range officer concerned, the women are always more than the men. So in a state like this, and we've also found that the admissions that are taking place in the public schools, there are more girls taking admission in the schools than boys. So we found it very odd that the 0 to 6 ratio should be skewed up. So we are doing a study and we find that probably this figure, which has been, in the last census 2011 of 890, seems to be wrong somewhere. One worrying fact is, in fact, the fact that although we are doing very well where most sectors are concerned, tuberculosis has always been a problem. Tuberculosis was a problem even before our merger with the rest of the Indian Union, and even during the Chogyal or the King's time, tuberculosis was an inherent problem. And somehow even today, we have really not been able to grasp with the situation, and we are trying to find ways and means how we can really take care of tuberculosis. The others, you can see that all our ratios are good. We had a large problem of iron deficiency and goiter. We have been able to overcome that. And then talking about some of the initiatives that we have taken, which are specific to Sikkim. We started a program known as CATCH program, which is the Chief Minister's Comprehensive Annual and Total Health Checkup for Healthy Sikkim. Now, this is a program which definitely was unique to the country. I don't think even till now, any other state is taken up this program, where we have formed a team which is going from village to village and even to the remotest of area and doing a health checkup. Our motto has been that when people don't come to us, I mean, you don't reach us, we reach you. You know, you'll find that large number of people, for some reasons, they don't sort of take advantage of the public health facilities. We have said, okay, you don't come to us, we'll come to you, and we have gone to their doorsteps to find out. And almost every individual in Sikkim, his health we know. We have created folders, files, and we are even issuing health card that was talked about in the morning, which contains all the useful information, including the blood group, whether he's a diabetic, whether he's a hypertensive, and now in the sort of whether he's an asthmatic, whether he's allergic to any drug, it is all noted in that small health card that we are giving. Now what we have decided that after we completed the whole population has been screened once. So we said now, instead of doing the screening again and again, what we've decided to do is that now, you know, as a sort of, as an innovation, or to make it more effective, we said now we'll concentrate on detection, early detection of cancers like oral cancers, breast cancers, and cervical cancers. For cervical cancers, we are using the VIA method, visual inspection by acetic acid, which is a known method, accepted method for screening of large number of people, especially for public health purposes. And for this, we've trained most of our nurses at the periphery. So even when gynecologists and medical officers are not available, the GNM nurses and ANM nurses, they are doing this screening. Then we're also using this program for early detection of diabetes, hypertension, and high cholesterol. And now we've added two other important things that we want to detect: rheumatic heart disease and its early cases. And since tuberculosis is a problem, we want to see that through this program that we pick up early cases of tuberculosis. Now, as you can imagine, you know, Sikkim being almost a landlocked state, very remote state, our primary and secondary health care very good. But obviously we were having a problem with the tertiary care. And that was because infrastructure, but more important than that was because of human resource. You know, today, it is the private sector. In fact, in Sikkim, the private sector for us has become a problem because we can't improve our government sector. All our specialists and super specialists, even those students who are going from our state, they find that the private sector is very lucrative. They can give very high salary. So obviously, if somebody does an MD, MS, or a DM, he is most likely to join the private sector than coming back and serving the government. So this has been one of our problems, and because of this, we are not able to build that tertiary healthcare. So, but in spite of that, I can tell you that my patients, as far as tertiary care is concerned, probably are looked after better than any state in the country. We have devised the scheme in 2009, 2010. We did try looking into insurance, but we found that insurance was not working for us at that time because they had too many exclusions. Pre-existing disease was not considered, heart problem was not considered, diabetics were not considered, you know, alcoholics was not considered. And unfortunately, I don't know whatever the reason, whether we have more of a tribal population or cold climate or whatever it is, the alcohol intake in Sikkim is quite high. And we have cheap liquor also. In fact, it is one of the attractions for tourists because of cheap liquor. So because of this, we found that if we were to take up insurance, we would be paying more than what we are already spending. Then we decided we will devise our own scheme. So we came out with this Mukhyamantri Jeevan Raksha Kosh. And now under this scheme, we are paying BPL patients, those who are below poverty line, we are looking after their health almost completely, and routinely we are giving them up to 3 lakh rupees. Those who are not BPL and non-government employees and their dependents, we are giving them up to 2 lakh rupees. Now with this 2 lakh rupees, they can go almost any. We have tied up with most of the good hospitals in the country, and these people can go there and avail their all the facilities. Now let me tell you that in my own cardiology, I don't have a single heart patient who is a genuine Sikkimese not operated because of financial reasons. If he is there today not operated, it is because he's not willing to be operated, too scared of the operation, or for some reason he doesn't have the requisite papers or something like that. Otherwise, with this, and we have divided, we have empaneled hospitals in such a way that, and we refer the patient in such a way that within the 2 lakhs, they have to manage. Even if it's a triple valve replacement, that hospital has to do within that amount. Then, since when you have this system like this, we say, okay, don't use a St. Jude valve. You use a TTK, Chitra valve. But you have to operate. Similarly, for a pacemaker, somebody might say, okay, I want a dual chamber pacemaker. We said, no, if you want with this money, if you cannot have a dual chamber, then you'll have to have a single chamber. So what we try to do, we send these patients according to their pockets, according to the kitty, and he doesn't have a choice. If he doesn't have the money, he doesn't have a choice. He can't say, I want to go to Apollo or to Medanta. He will have to go to, we've empaneled hospitals in Siliguri, we've empaneled Durgapur, Calcutta, almost all the hospitals in Delhi. We've empaneled Tata Memorial, CMC, Vellore. So all these hospitals are empaneled. So, and I can proudly say that except in 2 areas we are having a problem. One is kidney transplants, because sometimes they tend to exceed, that 2-3 lakh rupees. And the other area is cancer treatment. So because of that, we're having a problem. Otherwise, most of our treatment, because of this scheme, we are able to treat. And a lot of these hospitals in Siliguri and Calcutta, they are also offering us cashless treatment. So the patients don't have to carry any money, they don't have to pay a single pie. And the other treatment that is taken in the other hospitals, the bills come to our department directly, we have a cell, and they look after the funds. Not only this, to make the treatment easier, we have even transferred funds to the resident commissioner in Delhi, so that people can avail, those who don't go without the letter from our department, they can go to the resident commissioner, take the money and avail the treatment. We have also created a bhavan, a special place where these people can stay for their treatment at absolutely throwaway charges. Like we have a bhavan in Delhi and we have a bhavan in Calcutta. Now we are coming up with a bhavan even in Siliguri and in Guwahati. So then obviously we have that SSIAF. This is another scheme where the BPL patients are treated. That this is a special fund which is also aided by the central government. In this, actually, these people are supposed to go only to government hospitals, but we have taken a special permission where they can go and get the treatment in the empaneled hospitals also. For government servants, it is almost routine that they can avail treatment up to 5 lakh rupees. So, and for monthly treatment, you can see that they can reimburse up to 15,000 rupees commonly. And for special cases like, kidney transplants and for dialysis patients, we are giving them up to 25,000 rupees. Well, this is the list of hospitals. If you see with the empaneled hospitals, right from Apollo to Medanta to Institute of Biliary Sciences, Rajiv Gandhi Cancer Institute, Apollo Calcutta, Medica, Thakurpukur, Durgapur, and all these hospitals in Siliguri, because a lot of patients, in spite of providing all these facilities, they used to say, we cannot go to Delhi. It's too far for us. So we panel Siliguri because this is just next door, and they feel much easier to go down there. Now this is another, you can see that for health, we devised another scheme, which is Mukhya Mantri Sishu Suraksha Yojana Evam Sutkiri Sahyog Yojana. Now in this, all BPL mothers, when they have their child, this was to encourage institutional delivery. If they deliver in the institutions, they were paid 3,000 rupees in addition to the central government scheme. And the child, in addition, now this is a unique scheme that the child is looked after till the age of 6 years. We are giving 500 rupees per month till the age of 6 years. This is put in the bank, and this is what we are doing since we started this in 2011. And we added one factor that, if you have a second child, because of that sex ratio, if you have a girl child, then even the second child would be looked after in a similar way. So that was another innovative scheme. And a few other things that Sikkim has done, we were the first state in the country to introduce hepatitis B vaccination in 2001, and also the MMR vaccine from our own kitty in 2009. We got the 4th RJD Tata Memorial Award in 2000 state for best performance in immunization among the northeastern states. Our infant mortality, I told you, is already 19, and we got the 2nd place among the stall states for reduction MMR in 2013-14. Florence Nightingale Award was awarded to our nurses this year also, and in 2009. Another very important scheme, sounds small but very, very big when you think of public health is concerned, that we banned very effectively smoking in public places in 2010, and we also banned the chewing of tobacco, the chewing of gutka and other paan, parag and gutka substances which contain tobacco. Now these, today we may not see the results, but if you walk into Sikkim, you will find that the incidence of smoking is really decreased. And if you're a chain smoker, you are likely to have a problem. And I'm sure, maybe even after I retire and 15, 20 years down the line, these schemes of really, not allowing chewing of gutka, not smoking in public places, is really going to pay dividends. And I'm sure that the incidence of oral cancers, other cancers, lung cancers, the incidence of stroke, cardiovascular problems is really going to come down. Well, this is something in brief that what we've been trying to do in Sikkim. Obviously, the funding from initially NRHM, now NHM, is really helped us. And more than that, what has really helped us is the vision of the Chief Minister. He has really been keen to see that health in Sikkim really develops, and we've not let money be a problem. Although you can imagine a small state, we don't have too many resources, we are pretty landlocked, and yet we have not let that make our people suffer as far as healthcare is concerned. And this is one of the biggest initiatives that we have taken. You can see this is a picture of the new multi-specialty hospital that is coming up in the state. This is a 575-bedded hospital with facility for upgradation up to 1,000 beds. And we are trying to have this commissioned within the next 6-7 months. And I'm sure once this is commissioned, we will really be able to give much better care to the people of Sikkim. This is just one of the pictures of a district hospital. This was the inauguration of the CATCH program, as I was telling you, and the RJD Tata Memorial Award. This is how we celebrated the International Yoga Day. Thank you very much.
Sir, please be on stage for a minute, please, sir. Thank you, Dr. Bhandari. I request you to please be on stage for a minute. I request Mr. Om Kasera, who is the Managing Director of Rajasthan Medical Services Corporation Limited, to present a memento to our guest from Sikkim, Secretary and Director General Health and Family Welfare. Actually, it is an award to Sikkim. It's a recognition to Government of Sikkim for outstanding achievement in the healthcare sector from such a small state in size, but doing a lot of work.